This is my student support system. Keep watching, keep learning.
Hello, welcome to my student support system. In today's class, we will discuss about osteoporosis. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel my student support system. What is osteoporosis? Osteoporosis is the most prevalent and most endemic disease of the whole world. It is degenerative bone disease. As the name suggests, bone become porous. Osteoporosis is characterized by reduced bone mass, deterioration of bone matrix, and diminished bone architectural strength and power. The rate of bone reabsorption that is maintained by osteoclast cells is greater than the rate of bone formation done by osteoblast, resulting in reduced total bone mass. Here you can understand by this picture, this is normal bone, but this is osteoporotic bone. Bone mass is very less. What clinical manifestations arises due to osteoporosis? Due to reduced bone mass or bone density, the bone become progressively porous, fragile, brittle, which may break easily. The most common fracture due to osteoporosis are thoracic and lumbar spine or vertebrae, hip fractures, and Colles fracture of wrist. There is gradual collapse of vertebrae and that may be asymptomatic, but there is progressive kyphosis like this. Kyphosis occur in the back, and due to this compression of the vertebra, there is associated loss of height. Means height is also reduced. So we can understand that there may be osteoporosis. What are the causative factors or risk factor for development of osteoporosis? There are many risk factors. First we can understand that is race. African American women who have greater bone mass than the Caucasian women, means white colored women, they are at most more risk for osteoporosis. Which women? Caucasian women. In the same way, aging is also a risk factor for osteoporosis. Older people are at greater risk or higher risk for developing osteoporosis. Sex. Here, male or men have greater bone mass or density, and they also do not experience the estrogen reduction. So, we can say that women or women gender are at greater risk for development of osteoporosis. Then diet. Of course, vitamin D is necessary for the calcium absorption, for normal bone formation or mineralization. People having low vitamin D diet are again at greater risk. Then lifestyle. Lifestyle also is responsible for osteoporosis because bone formation is enhanced by stress or weight muscle activities. Resistance and impact exercises are more beneficial for development and maintaining the bone mass, but immobility and sedentary lifestyle contributes to the development of osteoporosis. How we will diagnose? After uh, watching out for these um, clinical manifestations, we go for certain diagnostic investigation to confirm that yes, that is osteoporosis. For this, dual energy X-ray absorptiometry DXA, which provide information about bone mass density, is also helpful for diagnostic investigation and blood investigations such as serum calcium, serum phosphate, serum alkaline phosphate, vitamin D, urinary hydroxyproline excretion test are also helpful to diagnose osteoporosis. Then, what treatment can be done? The first line medication used to treat and prevent osteoporosis includes calcium and vitamin D supplements and biphosphonates. Adequate calcium and vitamin D intake is needed for maximum effect, but these supplements should not be taken same time as the by uh, bisphosphonates. So they should be given separate time for bisphosphonates and vitamin D and calcium supplementation. Then calcitonin directly inhibits osteoclast activity, thereby reducing bone loss and increasing bone mass density. Calcitonin is administered by nasal spray, uh, subcutaneous, or intramuscular injections. Selective estrogen receptor also given, such as raloxifene, to reduce the risk of osteoporosis by preserving the bone mass density without estrogenic effect on the uterus. Thank you students for watching this video. You can subscribe the channel for latest updates, and you can um, go for your notes formation by visiting blog mynursingstudents.blogspot.com, and you can also join Facebook group Nursing Notes. You can follow me on Instagram also. Thank you.